Okay, I'll go ahead and get started. And the first thing I want to say is Happy Nurses Week. And what I would really especially like to do is to thank every single one of you who are nurses, whether you're on this webinar or it's your colleagues or your friends or your peers, wherever nurses are, thank you on behalf of ARP's members and the families that we serve. So the work you do day in, day out, night every day, all year long, does not go unnoticed nor underappreciated by ARP. We deeply are grateful to all that you do. And I just can't thank you enough. I don't even have enough words to express my gratitude, but thank you. So, and thank you to all of the participants for taking the time to join today's webinar. We have an amazing lineup, as you can see, of these amazing nurse leaders. So thank you for joining for this very important conversation on developing a shared agenda to achieve health equity. What does it mean for nursing? And so we are super excited to have Dr. Lisa Campbell, who is the chair of the Council of the Public Health Nursing Organizations, Dr. Ashley Darcy Mahoney, the Robert Wood Johnson Foundation Senior Nurse Scholar and the professor at the George Washington University School of Nursing, Dr. Beverly Malone, President and CEO of the National League for Nursing, the new Dr. Rhonda Newsom, instructor for Texas Tech University Health Sciences Center, and Dr. Deborah Toney, the president of the National Coalition of Ethnic Minority Nursing Associations. So thank you all so much for organizing and leading us in today's conversation. So before we go any further, I do want to mention that we are going to record the first 15 minutes of today's webinar. So if you miss a section or would like to pass it on to a colleague, you can find the recording by going to www.campaignforaction.org/webinars. And at this point, I'm delighted to turn it over to Dr. Beverly Malone. Thanks, Bev, and thank you all.
Bev, we can't hear you. And we need the slides.
Thank you. Hello, colleagues. I'm delighted to be here. I'm Bev Malone, and I'm the president and CEO for NLN. And this meeting is about, first of all, providing just a space, a safe space to support the discussion of individuals, groups, and organizational experiences around controversial issues and why would health equity be a controversial issue. But it is, because sometimes we get it all mixed up with other things. We get into health equality instead of health equity. And nursing is really just a microcosm of the rest of the world. And while National Nurse Month, May, does purport to say something about how angelic we are, we know the reality. We're as human as the next person, but our roles are so special. Our roles are about hope and integrity and caring, and equity and inclusion and diversity. So these are those really complicated issues that are sometimes difficult to address because of our history and because of our presence. And it's also about discovering the work completed by 4 organizations named in the FON2020-30 Report Recommendation 1, and how it might inform a shared nursing agenda for addressing social determinants of health and health equity. All of that is connected. Could I have the next slide, please? These are the 4 organizations. And as you can see, it's a little bit more than 4. But we're all involved. The NLN's definition of excellence is co-creating and implementing transformative strategies with daring ingenuity. And that's what this webinar is about. Co-creating. We know we can't do it by ourselves. We have to do it with one another. And that's why these organizations are listed in the way they are. It's about how can we come together and use all this power that we actually have to do this good thing for nursing, to do this good thing for the patients that we serve and the communities and families, both nationally and globally. So next slide, please. I just want to mention the difference between health equity and equality. And I think that this visual here gives you a real clear picture about it. It's not, I treat everybody the same. I don't want to be treated like a man. I don't want to be treated like my good colleague, Lisa Simpson, right? I want to be treated with all of my individuality and my quirks and all that goes with it, and my situation, my health situation. So I think we as nurses, we have to move beyond that to actually a place where we can talk about equity. And equity is about understanding the context of who you are. It's all of those social determinants that come together and make you who you are at the moment, at the time of the interaction required to get you to a place of well-being. So next slide, please. And I will stop there.
Thank you, Dr. Malone.
And hand it over to my colleague, who I called her name, and voila, there she is.
Thank you, Dr. Malone, so much. Well, this slide is really important and provides a larger context about social determinants of health and some large-scale events that we have experienced recently. But I do want to provide some context setting. So when a patient comes into a clinic or a hospital, it is an episodic visit where you may address the individual's social needs. As an example, food insecurity, a need for transportation or medications. And then that patient goes home. And the social and economic conditions in the community where they grow, live, work, play, and engage in fellowship determine their overall health and well-being. In communities, the focus is on the entire population and on addressing the health differences, because we are not the same across groups, and targeted interventions to address the social and economic determinants of health that have their effect at the group level. And as you can see here, the large-scale social issues that we face, like Black Lives Matter, climate change, etc. Next slide, please, and I'm going to turn this over to Dr. Deborah Toney.
Hello, my slides are not moving. I have to move it. So Hello, everyone, and happy Nurses Week. I'm Deborah Toney, the president of the National Coalition of Ethnic Minority Nurse Associations. So I'm hoping everyone is aware of the National Commission to Address Racism in Nursing, which was launched in January of 2021. This work is co-led by the American Nurses Association, the National Black Nurses Association, the National Coalition of Ethnic Minority Nurse Associations, and the National Association of Hispanic Nurses. The commission during that time created a vision and mission, as well as a definition of racism. One of the early things that we did was to get an understanding of nurses' experiences with racism, and this is what we found. You'll see launched in October of 2021 with over 5,600 respondents. You'll see that 97 or 92% of Black nurses experienced racism in the workplace. And you'll also see that 73% of Asian nurses experienced racism, as well as 69% of Hispanic nurses and 28% of white nurses. The next slide will actually get into the impact of racism on health and well-being. And as we talk about racism being a public health crisis, just take a look at some of the comments, and hopefully it doesn't trigger you, but we also felt that it was important to know how nurses felt when they were confronted with acts of racism. I'm not going to read all of this to you. You can take a look at it for yourself, but you'll see racism has affected my well-being with having to take a leave of absence from my job in 2008 and 4 weeks diagnosed with severe hypertension. And after 4 weeks, they were denied further pay. You'll see comments, I have been called the N-word by multiple patients on multiple occasions. I've been asked not to care for a few patients by the patients themselves because I am Black. And then I have had a nurse manager been called colored by my nurse manager. So you'll get a chance here as you read through this, the PTSD that nurses are experiencing, the emotional trauma, the feelings of worthlessness, as well as living in constant fear. So I'm going to turn it back over to my colleague, Lisa.
Thank you so much, Deborah. So colleagues, the 4 organizations that are represented here today were called to lead an effort to engage in the work of mitigating social determinants of health and health equity, including a focus on addressing racism and promoting practices to ensure the diversity of the nursing workforce. Actions were to include within and across professional nursing organizations, as well as to partner with external stakeholders. The 4 organizations here sought to really understand the current and ongoing work of professional nursing organizations around DEI, health equity, and anti-racism activities described under the first recommendation of the Future of Nursing 2020-30 report. Of the 26 professional organizations that responded to the survey that we disseminated, a subsample is represented here today in the table before you. External and internal activities around DEI included practices around policy development, strategic planning, surveying their own members around these issues, trainings, support DEI legislation, and creating affinity groups. The barriers organizations identified to this work included lack of funding and staff, because as you all are well aware, the majority of professional nursing organizations are all volunteered. Resources needed included DEI best practices, toolkits, and funding opportunities. Now, I want to make a note about this table, that all survey questions were answered and therefore will not equal, not all survey questions were answered and will not equal the total number of responses, or 26. We had 22 national organizations, 3 state organizations, 1 international organization that had US-based membership represented in the sample, and only respondents indicating that they were not currently engaged in the work around DEI and other actions in the report recommendation 1 responded to whether they plan to engage in the related work. So colleagues, I'm going to pass it over to Dr. Rhonda Newsom. Rhonda?
Thank you, Lisa. Good afternoon, everyone. It's my pleasure to have this opportunity to introduce to you a resource repository created by 2 of my colleagues. We were students in the DNP program at Texas Tech Health Sciences Center. And on behalf of the 4 known organizations, we developed a collection of toolkits and articles addressing the work that has been done in terms of developing a shared agenda. And so we addressed recommendation 1 and its sub-recommendations. We were fortunate that the Campaign for Action and under the guidance of Aiden, she developed a way for us to make this accessible to all nurses that want to find ways to help address recommendation 1. And so under our recommendation 1, we address things such as eliminating racism and discriminatory policies, also ways to leverage expertise in public health nursing, expertise in coordination of care management, also ways to help develop resiliency and self-care efforts for our nurses. Another focus was to amplify our health equity related issues, also to decrease diversity in nursing that is in our current workforce and our future workforce. And then lastly, some of the topics that we discussed are how to award the contributions of nurses in terms of developing and achieving health equity. And so it was a pleasure that Tanya Lopez and Yursi Salazar-Lee and I worked together to create that as a resource for nurses so that those tools were available to them if they were searching for something to help them. Thank you for your time and thank you for the opportunity to discuss our resource repository with you. And those are our references.
Right.
Thank you.
Thank you so much. I now get the really wonderful benefit of moderating this rest of this conversation. I'm Ashley Darcy Mahoney. I am really proud to be among these colleagues chatting today and would really welcome us an opportunity to now have a